Hello, everyone, and welcome back to Clinically Speaking, the podcast where we explore real conversations shaping clinical practice, professional growth, and the future of patient care. I am your host, Biz Marie, the social media manager here at Ivy, and today we are diving into an especially meaningful topic for anyone entering the profession, day one in the clinic, what we wish we knew as new grads. This episode explores the transition into clinical practice, the moments that challenge you, the lessons that shape you, and the things you only truly understand once you're in it. Joining me today are several guests bringing perspectives across physical therapy, speech language pathology, clinical education, and early career development. We're joined by Alexis Del Palazzo, clinic director and partner at Ivy Rehab in Abingdon, Virginia. Alexis specializes in primary care, orthopedics, and pelvic health, and is deeply committed to advancing clinical education through mentorship, residency training, and developing future clinical educators. Also with us is Brenna Munson, a speech language pathologist who recently completed her clinical fellowship at Ivy. She holds a master's degree from Central Michigan University and is currently pursuing her PhD in industrial organizational psychology. Brenna brings a thoughtful perspective on early career development, leadership, and building an aligned and meaningful professional path. We're also joined by Krista Heffner, Doctor of Physical Therapy and Clinic Director at Ivy Rehab's City Hall location. Krista specializes in orthopedic and movement-based care with advanced training in dry needling, and she is passionate about helping patients return to the activities that matter most through individualized, patient-centered care. And also featured is Heather Iannelli, Senior Manager of University Relations, who brings a unique perspective on supporting students and new grads as they transition from academic training into clinical practice. Together, we're sharing honest reflections from our early days in the clinic, what surprised us, what we wish we knew sooner, and what we hope every new grad takes with them on day one. Thank you all for joining. Now let's get into it. So let's start off with I would say, a fun question here. Brenna and Krista, can you both tell me what was your first oh no moment in the clinic?
Yeah, for sure. I just before we started this, we were talking about how there have been very many oh no moments, and I feel like the ones that stand out to me the most are the things that I wasn't anticipating, and that's dealing with my first kiddo who had behaviors and not knowing how to manage behaviors. And the okay, come on, let's go play turned into a no, I don't want to. And it was the stop and staring game. It's like, well, now what? I don't know what to do. And learned a lot since then, but like definitely as a new grad, that was a big oh no.
And Krista, how about you?
My first, oh no, I think it was almost a month in of starting as a new grad. And it was like basically a textbook red flag referred out situation. And when that happens, I remember I had my CI. It's like we can, rely and kind of talk to the patient, the reason behind of the red flags. And I remember I was like testing the patient, and I'm like, oh, this is not okay. Like, let me do another test, and everything was just red flag and red. And I'm like, okay, this is gotta put my big girl cap, and I had to like kind of be very honest to the patient, refer out, and say I can't see you at this moment. And the patient actually was very, very grateful, and she honestly kind of sometimes cried. Because she was like, I've never had this attention to care or attention to detail. And I felt like, I mean, I may be wrong, I may be right, but you need to have some more care before coming to PT. And I think that was my big, oh no. And I was definitely nervous, like I'm now speaking, but it was the biggest one that I could remember early on.
And what were your first instincts after that oh no moment? Did you turn to someone for help, or did you try to figure it out on your own?
After the patient left, I went directly to my mentor. So we have like almost weekly, every other week recaps, and he was, yeah, you did the right thing, and I felt like more like safe, secure, and we're like, okay, I'm not overthinking this, because I feel as a new grad, you overthink every single detail.
And Brenna, how about you?
I was very fortunate to work with 3 OTs. And so turning to my OTs, shout out to all the OTs, just looking to them, be like, how can I support this transition? And they were more than helpful and just teaching me how to support kids through big emotions. And so just the collaboration between disciplines has been super helpful in getting through a lot of my oh no's.
Oh, that's great. And what did you realize on day one that school definitely did not prepare you for? And this is for anybody.
Just piggybacking off of dealing with behaviors, I also realized very quickly I knew very little about billing and insurance, what that process looks like. I could write a really good SOAP note, but as far as coding and all the metrics that go into it, that was a learn along the way, plus learn on onboarding.
Yeah, I agree with Brenna that I had a background. I worked as an office coordinator in a rehab department in PT school. So I knew the insurance side of it and I had a good understanding of authorizations. But when it came to like coding and how to really show the value of the care that I was delivering, I had no clue. So, day one, just did the best I could with it, and would have liked to have had more of that, especially in school coming in.
And Krista, how about you?
I piggyback again with the insurance. I think that's a big one that definitely is kind of challenging, and also different insurances ask different things at the same time. And that's one of the things. I recently took a student at the beginning of this year, and I asked them, what could you wanted more from us, from me? And they were saying insurance. So I did not have actually any patience for this 11 weeks that I was with my patient that required like extensive insurance authorizations. And as soon as she left, I got all of them. So I was like, I'm so sorry.
So since insurance seems to be a common denominator across the board, what's something you can kind of tell students in order to prepare for that? Is there a role they can take, or maybe like seeking out a mentor? What's kind of their best way to prepare for that or educate themselves more on the topic?
I would say one of the things that I like is when you're justifying for the reasoning behind a physical therapy, insurance likes to see a lot of like the metrics, the objective findings that you see and how they're progressing, whether it's like a small progression, but that means a lot, because if not, the insurance, all they want to do is deny, unfortunately. So I feel like any metrics, any findings, whether it's the outcome scores that they put or any range of motion, as long as it's progressing, insurances tend to be a little bit more, okay, they're progressing, they should keep it in PT.
Okay, great. Thank you. And what do you remember thinking on your drive home after that first week?
I remember just being so surprised at the emotional weight that I felt that I wasn't quite ready for, and just how much you give into your therapy and how much that takes a toll on you, especially compared to a university setting where you might have 2 or 3 clients a week versus up to 18 a day. That's a big shift and an energy change for sure.
Krista and Alexis, is there anything you'd like to add?
I've been out of school a while, but I think I remember when I started practicing, and I was in the middle. I practiced on a temp license until I took my board exam, and just those initial weeks, especially that first week of, I woke up and I was so excited to go in the clinic and just see my patients and learn new things every day. So that first week, like those memories have stuck with me of just how much gratitude I felt for, entering into the profession. Even though there are the challenges that we have within healthcare, really, like I always try to go back and find those moments and find those spots. And I always go back to just those initial memories I have when I finished school and started my practice.
Oh, that's great. And if you could go back to yourself on that first day of PT, like what would you tell yourself?
I would say be confident. That's my big word, because I feel like I always keep telling myself I know more. I went through this. I had the schooling and all the rotations, and just be confident. You know what you're talking about, and you know what you did, and so I feel like that's the big word for me.
I love it.
I would 100% agree with that. I would tell myself, breathe through it, give yourself grace, but remember that you are the expert. They're here to see the expert who is you. You've paid in wisdom for this. So just trusting yourself and that you know, and if you don't know, you know how to figure it out.
Oh, I love it. Such great advice. Alrighty, and kind of moving into more specific questions now. This is for Krista or Alexis. Can you tell me a little bit about the first eval that went completely off script?
Yeah, I'll take this one. It was my very first eval. So I mentioned that I was working on a temp license, and I showed up for my very first shift, and I had an interim clinic director at the site that I was working, and she was there to support that, those initial hours. And I had an eval on my schedule, and I had just come literally 2 weeks before this, had been in the medical ICU. Because before I've always worked in outpatient. That's where I've landed and where I love to be as a generalist. But I was also exploring different pathways. So for a period of time, I thought that I would go hospital based. So for my last 2 clinicals, I was in the hospital and did acute rehab, and then my very final rotation was acute care, so I could be in a more advanced rotation. So I was used to mobilizing people on ventilators. And my first eval in my clinic was treating somebody, a tennis player, with knee pain. And I did my evaluation. I was kind of rusty on my ortho eval, and I got to the end and I'm like, I don't know what to do with you. So I ran out to get advice from my clinic director, and she helped me. So guided me into, figuring out what was appropriate and, how to start treatment with that patient. And I had a good outcome with that, but it was definitely, I would say, going back to the oh no, that was my big oh no too.
Oh, wow. Well, I mean, it definitely made that first eval exciting then, I'm sure. And then Brenna, for you from the SLP side, can you tell me about the first session when a patient or client did not respond how you expected?
Yeah, I feel like this is a common theme in just treating in general, but I remember that very first week planning sessions for kiddos. Like, I knew the evidence-based practice, I knew what it should look like, but when you realize that the attention and the interest of kiddos is very different than what a textbook might say, I just remember, again, going back to like that, oh no, like, okay, here's this structured task, but they wanted to do anything other than the structured task. So again, we learn to pivot, we learn how to implement structure into unstructured, but yeah, as a new grad, it's hard translating that evidence-based into action.
Sorry, I didn't realize I was muted. I know Krista mentioned that if she could go back in time and tell herself on day one, she would tell herself to be more confident. So let's dive in a little bit into imposter syndrome. So can each of you tell me about a time when imposter syndrome really hit you the hardest?
I can speak on this, especially since I just transitioned Ivy clinics. I was up in Michigan and I moved to Indiana, still within Ivy. And I found imposter syndrome hitting me all over again, just changing settings, because you get used to your kiddos, you get used to your clinic. But then when you transition into a new environment, you're like, wait a minute, am I doing it right? They're doing it different than I am. So I feel like it comes in waves and can last for a long time. And just reminding yourself, it takes like daily reminders that you know what you're doing.
Yeah, I echo that. as I was building my clinical chops early in my career, I remember feeling a lot of just a lack of confidence and some insecurity that, the clinician I was practicing next to probably knew more than me. And I had to navigate through that. And imposter syndrome still hits me even now, less so clinically, but more like as I step into, new pathways, new roles, and I'm taking on, new things, new challenges. Those experiences that I had as a new clinician on the clinical skill side, like I recognize and I see that with new paths. So I think it's very natural to feel that way, but knowing that it goes back to that idea of confidence, that you know more than you think you do. But completely normal to feel that way, but having your resources and supports around you, your mentors, your colleagues, especially if you have those colleagues that are at a similar, level of experience as you, like really rely on them and lean in to talk about those experiences together.
I agree. With the help, the mentor is a big help, especially when dealing with imposter syndrome.
Mhm.
I can't remember how long it lasts, but it was long weeks, long weeks. But I feel like always having the mentor, having that conversation. We had one-on-one for a full hour conversation, and I would let him know my concerns about like specific patients, and they're like, "Oh, that's what I would do," or "You can also do this," stuff like that. It makes me feel confident. I'm like, okay, I know what I'm doing, but also that's great ideas. Because at the end of the day, I feel like as if you work at the team, you're in a PT place that it's you see everybody's patients, you see all the PTs, and you kind of feed off of those ideas in order to like become the clinician who I am today. And one of the most recent imposter syndrome is when I learned my course from dry needling, and I did my very first dry needling patient after the course. I was like, I feel like being a new grad all over again. So it's definitely something that's very normal, and I keep telling that to everybody who's going into the PT career about to graduate, that it's completely normal, and just as long as you have somebody there as a mentor, as a friend within the same PT, it's good. It's part of the process.
Thank you all for sharing your stories, because I feel like imposter syndrome affects everybody. And like Alexis is saying, like even now, still, even though it's with different themes, like it's still kind of looming always. And it is important to talk about and talk about how normal it is and how it happens to most people. And, so many of you touched upon some great points, but how was it that you pushed through those moments when it was affecting you the hardest?
I mean, to answer that question, also piggyback off of Krista, asking questions, practicing humility and curiosity, and then the mental transition between comparison against other clinicians to these are my teammates and I can learn from them, and we can work together to support kiddos. So I think it's just the humility of it's okay to ask questions and not to know.
What Brenna's saying, I think really speaks to finding an environment. So not internalizing that all on yourself. I think myself as a new grad, I probably buried my head in the sand a little bit because I wanted to figure things out for myself. But and so I took more of like this fake it till you make it approach, which I don't think is necessarily the best way to handle that. But having that supportive team and environment around you that creates that safety and that foundation to, recognize like it's okay to feel this way, but let's help you navigate through this. Like let's work on strategies to, increase your confidence and your competence. And be curious, learn along the way.
I love that. And I know how strong our mentorship is here at Ivy, and how, everyone really works hand in hand to make sure they're supporting their team's growth. So that's just amazing to hear. And lastly, to kind of wrap a bow on this imposter syndrome topic, what's one small win early on in your career that really boosted your confidence?
I would say my first discharge patient that I ever had. I was like, oh, I did that. I feel like a kid. It's like, yeah, I did that. So that was a good boost. I'm like, okay, I got this.
That's amazing.
I think for me, it was when I started getting return patients that, oh, I did something for you that stuck with you, that resonated. So I must be doing something right.
Mine was just getting the feedback. Parents telling me that kids were excited to go see Miss Brenna. That made my heart happy that they felt they're safe and they had fun while we did hard things.
That's amazing. Thank you all for sharing, and congratulations on all these accomplishments. You're all incredible. Now, moving into clinical skills are not necessarily job skills and the differences between the two. What are some non-clinical skills you wish you learned sooner?
Documentation was a big one for me. And learning how to document effectively with Scribe IQ. I know this has changed, but when I started my CF, we didn't have Scribe. And so learning that it's okay to document in session, because that is a part of your skilled therapy, is skilled documentation. And to have the best documentation, you need to document in the moment when things are fresh. And then also, as I previously mentioned, the emotional impact and how can you compartmentalize. So those soft skills that aren't necessarily taught in school, but are super necessary for work-life balance and well-being, because you don't want to absorb all the emotions of your kiddos, but be able to support them through that.
Thank you, Brenna. Krista, Alexis, any thoughts?
I would piggyback again with the I can't say that word, compartmentalize the emotions the patients give to us, not bring it home or bring it to a different patient. Learning how to take that in all PT settings, and I would say from like hospital, in rehab, and outpatient, you're gonna have those patients, and I feel like it's very important to learn. You're gonna figure it out as you go. But that was a big one, I would say, for me.
Yeah, and with this question, it came to mind for me when I was going through school, because I'm a career changer. I came to PT as a second career. So my past self and all the experience that I brought to being a PT student and then stepping into this clinical role, I really do feel like I was sort of put into a box when I was in school where I had to kind of put those other identities on hold. But I like to have my hands in a lot of different things, just as a past entrepreneur too. Like I like to have a lot of projects. So the idea that I could do those things and spend some time like figuring out how to, craft my clinical career around, specific patient populations. I think that skill set, particularly like marketing yourself and branding yourself, especially if there's a niche population that you want to work with, building that skill set to achieve that. I wish that I had done more of that as a new grad. And then just the self-leadership skills. So getting comfortable with, taking ownership of your path, so that you maximize your fulfillment, working with your patients and your populations.
Thank you all for sharing, and kind of piggybacking off of what Brenna mentioned on documentation. Can we talk a little bit more about that and what surprised each of you most when it came to documentation?
your notes don't need to be 2 pages long. I feel like in grad school, you learn how to write a super detailed note with every little thing. And yes, we want detailed documentation, but there are ways to communicate what happened in session efficiently without the extra medical jargon, and then also without the extra unnecessary fluff. So it's concise, easy for insurance to read, easy for patients to read. It's a simpler process, especially with Scribe now.
Awesome. That's good to know that they don't have to be so long. Alexis, Krista?
Sorry.
No, go ahead.
I would say with the Scribe IQ, how it took me when it got released, it took me like at least 3 weeks to like, okay, I need to use it. And ever since I started using it, it's a game changer. So I like to read their feedback, read how they, of course you need to proofread it and everything. But it took me 3 weeks and I'm happy I did it.
That's awesome.
No, 100% for Scribe. But I would say it probably took me about 3 or 4 years to get to a point where I felt like I had a good template in my head of how to be more efficient with what I was documenting, rather than trying to reinvent the wheel with every single note that I was writing, or trying to think through what details needed to be on the note. So I've gone through many different versions of what that looked like. But it took me a while to get to a very succinct format that worked for the note, that included, what needed to be there. And now that we have Scribe, like all of that is there in a much easier format. So I've been very excited and grateful to have that technology.
That's great. No, that I've heard so many amazing things about Scribe IQ and how it's really improved work-life balance. I think Brenna touched upon that a little bit, and that's just amazing to hear that we've been able to provide that for our clinicians. And to close the loop here on documentation and non-clinical skills, what's one efficiency tip you wish you had as a new grad? And I'm going to start with Brenna.
I would say just be more go with the flow. I would spend a lot of time planning activities, preparing materials, where in the peds world, at least, kids just want to be kids and they want to play. And we can implement therapy into what they're interested in. So letting them direct the activity, but you intervene with the therapy and following the kiddo's lead. I think that could have saved me a lot of time on the prep side.
Yeah, I think as new grads, I fell into this trap of, when you're working with a patient, you're trying to work on all of the things in one session. So picking a goal to work on for that session, having a focus, it avoids over planning, to Brenna's point, but then it's helping you keep the session streamlined, especially if you're juggling multiple patients at one time. It really helps you keep the focus, keep the goal of focus of that session. And then you're structuring, based on the patient's responses. So it allows you to stay patient-centered, but you're also not getting in the weeds of trying to do all the things in one session, especially when managing, other demands.
Thank you, Alexis. Thank you, Brenna. And Krista?
I would go with the goal as well. That's the first thing that jumped into me when patient says return to running. That's our goal, depending on what body part we're working to, and to reach that goal. It helped that the patient is being heard, and that we're here for them in order to return them on what they desire what to do without pain. So I would say a goal is what I kind of drive for in patient's recovery.
Great. Thank you all. And now let's jump into the art of communication that no one trained you for. So what was the hardest about talking to patients early on? And Alexis, we're going to start with you.
For me, it was a fear of saying the wrong thing to the patient, that I wouldn't be giving them the education that they needed at that moment, or I was going to give them the wrong information, or not say something right. So it took a lot of practice and reps to get more comfortable with that. And because I do I'm an educator at heart, so that carries over. And since day one with my patients, where I do provide a lot of education, I want to give the patients the why of what we're doing and why we're doing it. So, that was the biggest piece that I think was the hardest for me to get comfortable with, just because, just that sort of imposter syndrome too is like, I'm so new, am I really telling you the right thing?
Mm-hmm. And Krista and Brenna?
I would say educating them with not medical terms and more in first people, that was the hardest part for me, because I was just, okay, I'm off of school, off like taking the boards, everything's just medical terminology. And I've caught myself a lot of times when I would explain something, they're like, wait, what? They would just look at me with crazy eyes. I'm like, oh, wait a second, I don't need to do this. I need to put it down in easier terms. So I think that was the hardest one for me.
Yeah, and to piggyback off of that, Krista, it's learning how to explain therapy without sounding like a textbook and remembering that people are people. So use people terms to talk to people. Talk to them like you would your friend. And then I also think, just in the niche world of speech, is that talking to patients early on, or talking to my kiddos, is that their communication needs were so different kiddo to kiddo. And so being able to meet them where they're at, wherever they were at, to just make sure the care was individualized. That was tricky at first.
And did anyone ever encounter any awkward early conversations with physicians, parents, or caregivers?
I still, to this day, find it tricky to talk about like attendance, compliance, especially in the healthcare field, where we just want to give and we want to pour and we want to support, but remembering that we do have certain expectations of our clients, because we have so many people to support. So we want people coming in so that we can discharge and get new people in. So it's awkward to have those conversations.
And Alexis, I know you had a story to share as well.
Yeah, in my first year of practice, I had a patient come to me who was complaining of chest pain. So I took his vital signs, and I took him into our staff office where there was a phone, so that I could start by just reaching out to his primary care provider. And I had to leave a message with the person who answered the phone, and I advised the patient that he really should go to the ER, which he declined to do. But in subsequent follow-up, there was a gap in communication of what I communicated to his physician's office, and then what was ultimately communicated back to him, where the symptoms that he was having ultimately seemed dismissed. I mean, he was ultimately okay, but there was definitely that gap in communication. So it prompted me to do some reflecting of how I communicated that. Did I communicate the immediacy and the urgency of what I considered to be something that was concerning? So, that really gave me insight into, how I need to own those communications, to be very clear, to state what's concerning with the patient. So I felt like I did what was best for the patient in that moment, but it was not as effective or as coordinated as it could have been.
Thank you for sharing. And, I'm happy to hear that you've learned and that your communication has improved since then. So that's amazing. And lastly, last question in this segment here, Krista, what is your go-to way now to build trust quickly with patients? And this will be a question for everyone, but we're going to start with Krista.
Way to build trust. I like to talk about life with the patients. Get to know them, not just like, you're a subject here, you're here for knee pain, and this is all we're gonna talk. I like get to know them. That's why I love being a physical therapist. I get to see them 2-3 hours a week, make great connections with patients. And I feel like that is a very touching moment in order to gain a lot of trust and just kind of feedback like, hey, what do you do this long weekend? And if they had a win, it's like, hey, how was your wedding? And vice versa, them with me. Like, I feel like I love yapping and chit chatting with them. So I think it's a good way to gain some trust with the patients.
Krista, I'm a professional yapper. I yap to kids for a living, so I love that. I totally agree. And it goes back to people are people and not overlooking the element of authenticity and just being yourself and learning what motivates them, what makes them excited, because the goal is generalization. So how can you promote therapy while also supporting, like, how can we implement what we're working on into those things that you love to do? So yeah, just people talking to people while working on common goals.
Yeah, and I agree. A big topic or conversation in my clinic when I'm talking to my team, it's just when I approach building trust is, from that first day of meeting people where they are. So whether that's adapting my communication or, maybe I have this list of things that I know they'll benefit from, but maybe they can only take in one thing that day. Maybe, they're at their max. So being able to recognize and respond to those cues so that you're giving them the right care at the right time. And then just being, I love what Krista was saying about, just talking to them. So I love using the time that I'm doing manual therapy on a patient to really get to know them. So it's kind of, quiet time for my brain to stop processing and like assessing to where we can really drop in and learn more about them and talk about their goals. So I love that time. And, you get the benefit of the therapeutic touch with talking more about what drives them.
That's amazing to hear that creating that relationship with your patients means so much. Last week, I had the opportunity to visit a few of our clinics in New Jersey and speak to our patients. And one patient said the most sweetest thing. She said that she wasn't looking forward to getting discharged because she wasn't going to be seeing her friends on a weekly basis anymore. And I thought that was so sweet because she's like, I come here, it feels like home. She went twice a week. And she's like, they're just all so loving and they want to hear about me and my day. And it's just, who would have thought that PT would really make someone smile that way? And it's just amazing to know that all of you therapists are really making a difference in so many people's lives. So thank you all for what you do, because you guys are rock stars. And now let's go into some things that you thought would matter and then things that actually did. So what did you first stress about as a new grad that feels a little silly now?
I would say definitive data. I used to tally and check really hard, but found out very quickly when working with kiddos and when we're running between gym and room and toy room and all of that sometimes we use approximate data. Best 3 out of 5, give or take. Of course, when we do like progress notes and evals, then we'll take hard data. But I remember stressing to get every single utterance or every single instance where now it's a little bit more organic, I would say.
Krista and Alexis, how about you? Anything you think that feels silly now that you were stressed about before? Or was it all stressful?
The longer I practice, the more I think stressing about like finding the perfect intervention for the person. If someone, a patient comes in and they're asking for a specific treatment, I will do that. I remember I've had patients come in asking to have their back ultrasound, which there's no evidence to support that, but it was a beneficial treatment for them, and that's how they bought into therapy. So again, meeting the person where they are, but then if I'm getting that buy-in, I'm getting that rapport, it really doesn't, I'm stressing less about the treatment and the intervention and more about how am I using the people side to achieve their goals. So it's a balancing act where I'm going more people based and behavioral based in how I'm engaging with my patients more so than, getting after a particular treatment.
And Krista, how about you?
Something silly. I think there's always still silly things, but I would agree with like finding that specific treatment. I think you overthink everything as a new grad, especially with the imposter syndrome. And sometimes it's not going to work and sometimes it's going to work, but it's okay if it doesn't, because I remember those first couple of weeks I would go home and work hard to see like what can I do for the patient in order to get them to their desirable goal. So I was like hard on myself that way, but I quickly learned that like it's okay. It's okay to be there, but eventually you kind of like, oh, wait a second, I just laugh at it right now. And it's silly, like you say.
And now the opposite of that, what mattered more than you expected?
Contradicting what I said about collecting all the data is waiting for data until you have rapport. Rapport is crucial. I can't speak for the ortho side, but I know impedes to get these kiddos to buy into a skill that's either scary or hard or unfamiliar. They need to trust you. And so sometimes that will look like not having concrete data or minimal trials for a few sessions. But if that means that they're coming back to therapy independently or coming back to therapy excited, that means way more than the data or the intervention, because rapport is part of your intervention.
I would agree with that. Listening to the patient, it's what for me I think matters the most. See how their previous session went, how their activity after the session went, if it was beneficial or not, and I feel like they feel heard, not just like a subject, like I mentioned in previous conversations. And they kind of return like, oh wow, she's listening to me, she's listening to my problems and listening how I'm able to resolve those problems in order to get them where they want to be.
And Alexis, how about you?
I agree with what both Krista and Brenna said. It really comes down to the rapport and the people.
That's awesome to see that it's the same for ortho and peds too. Really interesting that there's some things that overlap there. Now, did your idea of being a great therapist change over time, or has it stayed the same?
Stay the same. I still love what I do. Different new challenges every day and every month, every year. But I still love it. And I feel like I'm still have those hard cases that I ask mentors, ask my teammates, and come back home and also do my research and make sure they meet their goal. I love it.
Oh, that's awesome.
Not to contradict that, but I would say my idea of being a great therapist is always changing. And what does it mean to be great in a client's eyes or in the clinic? And before, where I thought it was get kiddos in, get intervention, discharge. I used to think successful discharge is what it meant to be great. But now I'm realizing more and more it's about the relationships and the confidence and the soft skills that you can teach these kiddos. Not only are we teaching them how to say words, we're teaching them how to say their words to affirm themselves, make new friends, participate in different environments. So less about the what and more about the why is how I see the development of being a great therapist.
Oh, that's interesting because we always hear so much about our why, but not about the what. So I like that. Alexis, how about you?
I would say that it has. So, being, as a new grad, I think I came in with this mindset too, and, this conception that, the only way that I could be a great therapist was that, if I had purely undivided time for each patient. And when you are working, in an insurance-based clinic, like that's not always a possibility or feasible. Or I would even say that, patients don't necessarily benefit from that one-to-one approach across the board.
Mm-hmm.
So you can use that as an intervention too, but then, being a great therapist, developing your efficiency, as you're building your clinical skill set and chops and you're getting your reps, taking on that challenge of like, how am I increasing access, to help the widest number of patients, without handicapping yourself by saying, I can only see this many because, this is all I can do. It's a balancing act. So it's a lot of those soft skills too, and, developing in yourself and developing your own skills to get to that point to be comfortable with that. Because there's a lot of different variables that exist, within our realm, within the clinics every day, that, go beyond patient care, but the patient, stays at the center of that. But, how are we showing up to serve them? And then, being a great therapist, means that you have the skill set to handle that and handle, being flexible and handle whatever comes your way.
Beautifully said. And then now we're coming up to the last few questions here of the episode. So let's touch into a little bit about what you're still figuring out. So what are you all still learning now? And I'll start with you, Brenna.
I think the beauty of our professions is that evidence is always changing. And so we are always learning specifically skills within our domains. But for me personally, and part of my PhD experience is just learning more about what helps us pour out, but also refill.
Mm-hmm.
And so that's something as a new grad that I'm continuing to learn. I say new grad, 2 years out now, feel like a new grad sometimes. Continuing to learn is just how can I be the best version of myself and show up for these kiddos and families every single day. Because like Alexis said, it is a balancing act, and it can be tricky when the pace of treatment is really hard or is really quick, and you feel like you're giving more than you can fill up. But there is a way to do it, and hence my whole research pursuit here. But yeah, I think that's it, always evolving, just learning how can I be the best version of myself and be the best version for other people.
I would say adapting to whether it is new technology like Scribe IQ. I do feel like in the PT world or the rehab world, things are constantly changing, whether it's research technology. I feel like I always have to kind of adapt myself into it in a good way, because things change. Like you kind of grow as a person, grow as a clinician, and grow within the company. So I think that's the biggest one, just kind of learning to adapt, and don't be afraid. For me, it's always asking questions if needed, if you are struggling with anything. So adapting is a big one.
And what do you wish newer clinicians knew about long-term growth? And Alexis, I'm going to start with you for this one.
I think staying curious. I think that that's a theme that has emerged from what we've talked about so far. But I recently read something that broke goals into two camps of performance goals versus learning goals. And learning goals, especially when you're developing yourself and you're figuring out, what your path is in clinical care, is learning goals are going to keep you more open and curious, and it really facilitates a growth mindset so that you're open to new experiences, and then also open to, if you try something and fail, that's okay. Like, failure is really what we learn the most from. So finding goals that help you learn. And I love the therapy professions for that reason, is that, we can show up to work and learn something new every day. So versus just going down a performance goal of like, I'm going to achieve this KPI, or I'm going to have like all my discharges are going to be successful. Like, really, focus on that growth from a performance, from a learning, a learning path versus, process oriented versus results oriented or outcome oriented.
Thank you, Alexa. And Brenna, how about you?
I would say what I wish newer clinicians knew about long-term growth is that soft skills are your saving grace. And that in order to develop as a professional, you need to also develop as a person and learn more about yourself, what gives you energy, how do you best operate, and learning how to care for yourself so that you can care for others will not only help promote outcomes personally and for your clients, but sustainability. You can't run out of energy. You can't run out of steam too quick. You need to learn how you can support yourself for long-term sustained growth.
Thank you, Brenna. And our second to last question here is, what makes you excited about staying in this profession? And Krista, we'll start with you.
I would say the continuous growth that is always evolving in PT, with the new research, or for me, it's like the new continued education. I got to learn dry needling. I got to learn gait analysis for runners. So there's always something out there cool, because I always want to learn something cool, something new that I can utilize. And there's so many options out there. So I feel like that is one of the ones, continued education with PT.
Alexis, how about you?
I had just said it, but like, just getting to show up to work every day and learning something new, whether that, as I go into the next phase of my career, some days it's less clinical, but I break things down into different buckets. So, working on my leadership skills, trying to learn something new clinically every day, or, sitting down and doing that once a week. But, I aim to never stop learning, never stop questioning, being curious, because there's always that next piece of the puzzle that, maybe answers a question that you've had for years. So that is one of my favorite parts of being in the profession of PT.
Amazing. Thank you. And then Brenna, how about you?
As it relates to the long-term growth or just being excited about this field, it's always, like Alexis said, I will never not be a student, whether in a school or whether just growing my professional portfolio, is that there's always something to learn, and I will never know it all, and that's more than okay. And that's what keeps it so exciting, is that we get to just always grow, and there's always something new. We will never cap out in what we can achieve within this field.
Amazing. Thank you all. And before we get to our last question, I'm going to bring Heather back onto the stage, and she's going to talk a little bit about students and CIs.
Thank you. I've loved listening to this. I've taken notes just for myself. But, I think one of the great things about being a student is, you're going to be a student forever, but while you're a student, people love to give back to their students. So while you have that second pair of hands, not being afraid to ask questions, or if you have someone in your clinic who's board certified and you're interested in learning about oncology, or they went through their residency program, now is a really great time as a student to test things out. Your clinical affiliations, they're an opportunity to learn, they're a requirement for school, but they're also a really great chance to figure out, what do you like? What don't you like? What productivity fits best with your work style? What type of employer are you looking for? So, for students, really taking advantage not only of, the time in your clinic, but connecting with your clinical instructor, learning, from their peers. Clinicals are a really fantastic opportunity to not only better yourself today, but for the future. And even if it's not somewhere you see yourself your first job out of school, you never know where you'll end up. You might want to switch careers. You might want to pick a different setting, or you might just make really great best friends on your clinical affiliation. So really using that opportunity to not only learn for school, but for life as well. So we love when our students ask us to shadow or to try something new or go on a visit to, a physician's office. So please, as a student, don't be afraid to really lean in on that student card, because this is the one time you get to ask every question under the sun, and there's someone there to answer it.
Amazing. Thank you, Heather. And I'm going to leave you up here for our last question. Our closing question today is, if a brand new PT, OT, or SLP listener is driving to their first day tomorrow, what is one thing you want to tell them before they walk in?
I can start. I would say give yourself grace. This is new. It might be scary, but it'll get easier. It's okay not to know. Ask your questions, and just remembering that your presence makes an impact. You being there is positively supporting other people, and that you're doing great things. You're so brave.
I would say I first say congratulations. It's hard, and you made it. And I would say, like I said before, be confident. You got this. You know more. It's just gonna be a breeze. I'm here for you if you have any questions, and you can always use anybody for any help. We're here as a team to help you out.
Yeah, I would say everyone has had a day one, so don't be scared, and enjoy this moment of not being the smartest person in the room, because there will be a day where folks are looking to you on their day one. So just take the time to enjoy where you are today, embrace the process, and remember, everyone started where you're starting today.
Yeah. And be curious, and give yourself, in addition to giving yourself grace, give yourself time. Like you don't have to, push to get all the things done in your first year. You have your entire career. And Rome wasn't built in a day. So, be patient with the process, and good things will come.
Amazing. Well, that concludes today's episode of Clinically Speaking. Thank you, Krista, Brenna, Heather, and Alexis for being incredible guests today. Please, everyone, connect with these amazing teammates on LinkedIn. I'm sure they will love to connect, answer any questions that you have. We have so many incredible opportunities here at Ivy, and we do have another Clinically Speaking episode coming later in Q3. So be sure to save the date and tune in for that once we post it on our LinkedIn page. Thank you all for tuning in, and have an amazing Thursday. Bye, everybody.